and so our souls are restless. St. Augustine says, until they rest in thee. Among the emotional disorders so common among us are general anxiety disorders, 7 million adults, panic disorder, 6 million adults, social anxiety disorder, 15 million people, specific phobias, 19 million people. Women, you are twice as likely to be affected by this as men. Symptoms typically beginning in childhood. The average age of onset is 7 years old. This is not something you just grow out of. Obsessive compulsive disorder, post-traumatic stress disorder. Those two are closely related to anxiety disorders, which some may experience at the same time, along with depression, and on and on and on and on. You know what? We never heard of any of those things when I was young. The term stress, did you know, was not invented until the 1950s? So we have to be careful to get up to speed on what these illnesses are and what, as a community of faith, the resources are we can bring so that burdens can be lifted and that people can find rest. So let's look at how Jesus treats, and I mean that now as a physician, this person in our story. Does Jesus just pray over him and perform a miracle? No. And that's a very important question and observation to make, because Jesus, the great physician here, becomes a model for the way you and I need to treat emotional illness that is so prevalent in our land. When this bipolar person sees Jesus, the man is symptomatic. Part of the problems of emotional disease is that it's not always present, is it? But it's usually triggered by some event, by some external agent. And so you never know when it's going to happen. In this man's case, it was the presence of Jesus who triggers this man's unnerving response. We're told he falls down before Jesus and he shouts at the top of his voice. You imagine? Now, did he fall down to worship Jesus? No. He fell down most likely to block Jesus from getting away. Is it okay if people come here not to worship God, but just to give voice to their sadness? To find human compassion, human fellowship, and a sympathetic human heart? The man is desperate. Desperate for what? He lacks clothes, he lacks food, he lacks shelter. Are those the things he needs? No. Clothes, food, and shelter alone are not going to provide what he needs. Like a bandage on a festering wound, the needs of the soul lie deeper than caring just for the flesh. Luke is clear to point out that it's not the man who needs Jesus, but what's inside him, which Luke calls a demon. It's the illness, not the patient, that must be treated. And sometimes we confuse the two. The illness begs Jesus, quote, "Do not torment me." That's an interesting phrase, isn't it? What the Greek verb translated there, torment, means is to cross-examine. Don't ask so many questions, the illness says. And anyone who has ever been challenged by their loved ones to please talk about what's bothering you that they don't want to talk about will tell you that experience is very uncomfortable and it feels like torment. Luke knows what he's talking about. Verse 29 says, "For Jesus had," quote, "commanded the unclean spirit to come out of this man." That suggests process and a period of time. How do I know that? Because the verb here is in an imperfect tense. It's not a one-off thing. It's in an imperfect tense, which indicates an ongoing activity. There's a parenthetical explanation in this text that talks about that interim time. What does Jesus do during that time? He examines him as a physician would in order to, notice, diagnose him. What is your name? He puts a name to the disease before he tries to cure it, and so must we. My friends, don't say it's just the blues, or it's just your imagination. Questions, answers, questions, answers, until you find the name. Emotional issues are not instantaneously alleviated. That takes time, and it takes patience, and it takes tough love that works in a dynamic process. Questions, answers, for as long as it takes until there is a desired result. And finally, and this is very important, the text makes clear that not all the consequences of being diseased for a long time disappear once the person is rehabilitated. Steps 8 and 9 of AA's 12-step program ask the alcoholic, quote, "to make a list of all the persons harmed by the disease and become willing to make amends to such people wherever possible, except when to do so would further injure them." Aren't you wondering, how did the rehabilitated man deal with those poor pig farmers who lost all their pigs that day because of this